It seems that there may be an annual rhythm to MIPS quality reporting. What does that rhythm look like to you and your team, who's constantly talking to the MIPS participants out there?
You are absolutely right. MIPS, reporting MIPS is a cycle, and it follows about a 15-month calendar. So we usually break this up into quarters, quarter 1, 2, 3, 4, and 5. Our goal or our project plan, your way to optimize your best results working with us, is to really get started in quarter 1. So quarter 1 would be January, February, March of 2025. We want to make sure that your 24 submission or exemption, if that applies to you, is already resolved. So we want to make sure that's taken care of and buttoned up. And then we want to immediately jump to 25. So there are lots of things that need an early start. For example, there are new measures and improvement activities that are arriving every year. Measures, improvement activities also retire. So we want to see if measures you've reported previously are still available, if there are new measures that are a better fit. We also want to think about what is going to make sense for your practice this year. It's can be easy to kind of fall into a habit of, oh, we do the same thing we did last year, do the same thing we did last year. Lots of times that's okay. It doesn't mean it's the best option, though. So I really think it is important to, in the first quarter, take some time, think about how you need reporting to go this year, both in terms of group or individual, MIPS, MVP, technical changes, switching EHRs, a new billing company, new measures, new improvement activities. There are lots of things that at least need to be considered. One of the things that can happen is you can get into a habit, get into a way of doing things and not realize that over the years, the measures and activities change, and there might be better, easier options that more closely align with the care you're giving. So it's really worthwhile to kind of have what we call a kickoff call, which is essentially like, let's start the project. What are your goals? Who is at play? What challenges do you see coming up? And how can we make MIPS reporting meaningful and hopefully as least burdensome as possible? It really applies to all the different categories. Quality, we want to start as early as possible doing those quality metrics and making sure the documentation is in place. For promoting interoperability, that requirement is 180 days. So we are no longer in the days of starting your PI reporting in September and getting points. That's absolutely not the case. We need to have a plan early and make sure that some of those requirements, participating in clinical registries, making sure your certifications are updated, making sure that your dashboards are turned on in your EHRs. All of those things take time. And with the reporting requirement of 180 days, if you're starting middle or third quarter, we're already missing the timeframes we need for that. Another reason to get started early is for the cost category. We know that the shifting of the way that cost is scored will be beneficial to most practices. And lots of times cost can feel like a big kind of unwieldy category. Maybe you feel like you're in the dark or you don't have the information you need. We get it. We have a lot of containment strategies, mitigation strategies. CMS has started producing some patient level reports that can be really helpful in practices investigating where they're doing well or not doing well in the cost category. So the sooner we get started on understanding what we're dealing with and understanding what the plan is for the year, the better off we're going to be with the project and the better you're going to score. So really, quarter one is the planning and review timeframe. Moving into quarter two is really all about two things: implementation and validation. So this is where we're saying, okay, send us what you have. Send us your billing data. Let's look at your PI dashboard. Let's see, what are we dealing with? Kind of what's the state of the state, if you will. And then we want to say, what trends are we seeing? where are there possible vulnerabilities or concerns, and how can we address them? And so Q2 is really all about doing some deep dives. We want to do some deep dives into the data, make sure we're receiving all the billing data we expected, making sure if you're going to send us clinical files or if you're trying to use QDC, quality data codes, that all of those things are in place. Also, Q2 is really where we should be discussing what an audit would look like for you. This is one of those things that, it's easy to pretend audits aren't a problem until they're right there in front of you. So one of the things that I recommend our clients do as you're answering METs and not METs, as you're looking at data and choosing measures, is to talk to your consultant about if you were to be audited, what documentation would you have to have in place? This is a great way to improve workflows, improve documentation, maybe help some other projects going on in the office, and it creates a great safety net. In the event that you are selected for audit or CMS chooses to audit your practice or your submission, you would have at least had some consideration and some thought to what that might look like. The other thing that really happens in Q2 is we want to make sure that the assumptions we made in Q1 are what we want to go with. If you decide maybe you'd like to try a new measure in Q1, Q2 is the time to decide this measure is great for us, or, oh, this actually isn't the measure we thought it would. So this is kind of your testing, your validations. We're double checking all of our assumptions and understandings. Q3, as far as the MIPS project might seem like you're just kind of coasting, but it is not. So in Q3, as far as your current submission, you're probably just following through the workflows you already have, sending data at regular times. Maybe there are a few outstanding items for PI or other areas that you're kind of checking on. But as far as your current submission, it might seem like a mellower time. What we find is that in Q3, CMS is really busy. That's when we get all their feedback reports from the previous year's submission. So there's a lot to look at. We can see how CMS scored you in the previous year. If you've had providers who received different scores from different places, we can see how you scored in the cost category, what that ends up looking like in terms of points. Does that create a vulnerability for your current submission? Have we mitigated that? It also is when the proposed rule comes out. So CMS publishes the proposed rule in Q3. It is their statement of intention. It's what they say they would like to have happen as far as the rules of all QPP reporting programs in the coming year. This is a huge opportunity for every practice out there to decide and have their voice heard and decide how they want this program to go. The comment period of the proposed rule, I believe it's 60 days, and any comment that is made, the CMS team is required by law to respond to review and respond to. So this is an opportunity for your voice to be heard. I know there are lots of challenges in the MIPS program, even with MVPs and APP. And it's really hard kind of when you're in the thick of it and, you're trying to run a practice, you have a lot going on. But commenting in the proposed rule is the way that you can say directly to CMS, here's how this program works for me or not. Here are the challenges I'm facing. Here's how I would like to see it be done differently. So I really recommend that, everybody, large health systems, medical societies, solo providers, support staff in the office, if you have ideas or concerns about how the program is working for you, for your providers and your patients, commenting in the proposed rule is a great way to have that concern or opinion heard. All of that happens in Q3. So Q3 can be quite busy in terms of, what's going on with CMS. They give us a lot of information there. So moving into Q4, this is where we're kind of making all of those final end of the year decisions. If for some reason you need to apply for the extreme and uncontrollable circumstances hardship to have one or more of the categories not apply to you, Q4 is the time to do it. We also want to make sure that all of the processes and decisions that we have put in place over the year in terms of the project really are what we want to do. Lots of folks maybe start with 10 measures, and then by the end of the year, they've narrowed it down or they choose their best 6. Lots of folks might decide that they want to work on a traditional MIPS and an MVP throughout the year. And in the Q4 is really where they're making those decisions about which submission is going to be in their best interest, what is going to make the most sense for them and their practice. And we're just kind of tying up all of those loose decisions, those loose ends, so that in Q5, which is January of 2026 in this case, we're ready to make submission. The goal is that you have all the decisions made, all of those confirmations in place. Maybe you're waiting on, some last minute billing or some last minute paperwork, but in Q5, you're ready to go and you make that submission to CMS. And then we start all over again. We go through it all again, starting for 26 reporting.